hai, but I hope you guys are enjoying the sessions and hopefully we'll catch up on time. Mulai farmayu talabtu amanna wa wajadtahu fi tarkal zanb. I sought peace and I found it in rejection of sin. Je halat mein apne rahe hai, the kind of peer pressures that our children face made us think about having this session to speak about the continuing challenges that our youth face. We're presenting this session about negative peer pressures by Dr. Lulua Mandviwala and Dr. Khuzema by Campwala, sorry. Dr. Lulua had graduated from Ross University. She completed her pediatric residency from Brookdale University, a hospital center in Brooklyn. She currently is the Kern County representative for American Academy Pediatrics and works at Kern Medical Authority in Bakersfield, California. She's in the outpatient and inpatient setting, covering level 1, 2 nursery and inpatient wards. She's also the medical student clerkship director for pediatrics. Also teaches medical students at family medicine and emergency medicine, rotating through pediatrics. She's married, she has 3 children, she loves to reconnect with family, and glamping in national parks when she finds time to do it. Following Dr. Lulua Bain will be Dr. Khuzema by Campwala, graduated from St. George's University in Granada, did his family medicine residency in Ohio, and has been in practice in Ventura, where he teaches family medicine and OBGYN. He is an associate program director for the family residency program at Community Memorial Hospital until last year, and the core faculty of residency program is an assistant clinical professor for medical students from Western University in Pomona, California. So I welcome both the speakers. Thank you again for joining us, and looking forward to another thought-provoking and exciting session. Thank you, Lulua.
Hello, can you hear me? Thank you so much, Alefia. Thank you for having me here. If I can just get a raise of hands of how many pediatricians we have in the house. We've got a few, very good. Family medicine practitioners, anyone who deals with kids, anyone who has kids, anyone who gets asked about kids. All right, so I think everybody might benefit from this just a little bit. So, Bismillahirrahmanirrahim, Assalamu alaikum. Again, I'm a pediatrician from California, Bakersfield, California. I was asked to give this talk, and when I was asked, I was a little flabbergasted. So as you know, I have 3 young boys. The eldest just turned 12 years old, at the cusp of adolescence, just the beginning. But that's not all. He actually also has attention deficit hyperactivity disorder, ADHD, as you guys might know. What you may also know is that they generally have poor impulse control, poor social skills, a lot of don't do this and don't do that, nesido bit, nahil, all the time. So when I was asked to give a talk about the challenges of parenting our youth in preventing substance use, that really hit home. My kiddo is high risk. Now there's decades of research out there, and I'm in no means an expert in this field. Some of you may be knowing more than I am, than I have. But I've tried to hone in on this topic to identify things that are relatable and share some actionable steps that we can take as physicians to not only help our community and patients, but also our mu'minin, bhayo, beno, and bachao in our community. So, who's ready to talk a little bit about sex, drugs, and rock and roll? Let me see, how we go. All right, so I didn't want to do any hand waving in this presentation. I wanted it to be primarily evidence-based. But the problem is that there's no data on mu'minin substance use. There's 0 data on mu'minin youth and their substance use or abuse. And that's something that needs to change. ITS matla updates apne aap hi diya. Can we get a little survey going, right? So that's the first thing. So the only thing that we can do is extrapolate from the data that exists from the US. Right, so this is from the National Drug Abuse Statistics. And 70% have used alcohol by 12th grade. 50% an illegal drug. 20% a prescription-based medication for non-medicinal purposes. I mean, without putting anyone on the spot, and let's just talk openly here, we're all healthcare professionals. How many of you, and some of you may have emigrated here, some of you have been raised here, how many of you have known, whether it's in some other country or in America, a teenager who's used or abused substances? With a raise of hands. Just look around for a moment. And we don't have any data on women in youth. How can we help them? We already know many people who smoke, who drink as adults. But did you know 80 to 90% of them started before they were 18 years of age? Right? Research shows that substance use does not necessarily lead to addiction. Shukar, alhamdulillah. All those people that you raised your hands, imagine, right? But what research does show is that cigarette use and vaping both lead to illicit drug use, which leads to detrimental and risky behavior, which leads to death and accidents. So something needs to change, right? So to understand how and why this may be occurring, let's understand the adolescent mind. Now, we have some neurologists here and neuroscientists and endovascular neurosurgeons, and the list goes on and on. So I'm not going to get into the full pathophys of how this works, but I want you to know a few key points. The pain and reward centers are mature first. So essentially, that means your child naturally wants to seek pleasure and avoid pain. Great. Naturally, they want to do that. That's normal for an adolescent. They're biologically wired. We can just hope and pray that they try to achieve and fulfill these biologically wired desires in healthy ways by hanging out with friends, by listening to music, or madhs and qasidas, playing sports, getting that release of dopamine in everyday natural ways. However, the prefrontal cortex, that's in charge of the executive functioning, the decision-making, that judgment, that doesn't mature until the early to mid-20s. So you see, the adolescent mind wants to seek pleasure, but they may do so in very unhealthy ways. So if your child is already hit with a lower baseline for exerting self-control, poor impulse control, AKA a child with ADHD, well, guess what? Now he's part of that high-risk category. So you see how this topic really shook me in my boots, right? I've got a child who has poor impulse control, who is marginalized for his poor impulse control all the time for not so important things. See the bit, stop fidgeting, pay attention. How many of you say these things to your kids all the time? Who will ultimately, if we continue, seek acceptance elsewhere, where he can do what he wants, how he wants, where he wants, and not feel judged or frowned upon. And that's really all on us as parents. So now that we know how the adolescent mind works, let's look at what's motivating these unhealthy behaviors. A lot of times this is research-based as well. It's usually because they want to fit in for social acceptance. They want to feel good for the euphoric effects, relieve stress and anxiety to level out the playing field, level out before going home and getting reamed by us over-controlling parents. They want to feel better. They may be in physical pain. They might be self-medicating for depression or anxiety that's undiagnosed. They want to do better. How many of us are pushing our kids, doctor ban, engineer ban, aam karwanu cha? And sometimes inherently they want to also. They want to, because it's so competitive in school and outside of school, they want to do better academically, athletically. So they may be dabbling in and taking Ritalin or Adderall, prescription drugs, without a prescription. They may just want to try something new or exciting, or simply they're just bored and they have nothing better to do, right? So let's be honest. Sometimes the more educated the parent, the more demanding we are of our children, right? So if you see these aspects in your life or in the lives of your community members who are struggling, help support them. Research shows being a part of and participating in organizations that clearly denounce alcohol and drugs have a protective effect. And similarly, decreased involvement in those like low religiosity, din si dur hoy, ek manama, they have a predictive effect for the use of substances. So yes, mola si qarib tha so, to drug si dur re so. But it has to be coming from within the adolescent, right? They have to want it. You can't force them to come to masjid every day. At some point, that's not going to work. So parents accepting their children for who they are and how they are is very, very important. Believe you me, it is very difficult. How you behave as a parent by being over or under controlling can also increase the risk factors. When the child does not feel accepted by the parents, it's a basic human need. They're going to seek elsewhere for that acceptance. And they may do so by accessing acceptance from inappropriate peers or inappropriate adults. And they may do things to fit in with those inappropriate peers. So we need to minimize marginalizing our Mu'mineen youth, especially within our community. How we interact with not just our own children, we also have to think about how we're interacting with other children within the community. I mean, next time you see a child or adolescent who looks like they're being a little naughty, inhe nazdeek le aavo, inhe vadare pyar ne support apo. Right? Don't reprimand and judge. I know many Mu'mineen, unfortunately, who've dropped out of madrasa because they were being bullied for not knowing Dawat ni Zaban as well, for not understanding things. That's not acceptable. Again, marginalizing the youth, making them feel not welcome, only furthering their movement from deen. So, but in addition to acceptance, we need to also screen for mental health disorders, depression, anxiety, mood and behavioral disorders. These are all underdiagnosed within our community. Understanding that they may not conform as expected and to move at a pace, understanding that they may not conform as accepted, that we need to move at their pace as well and be okay with that. Ee auntie ne kahi do ki balle thoda relax the jai, right? If the adolescent is marginalized, it doesn't matter how much you say, I love you dikra, I love you dikra. If they don't feel it, it's not accepted. And there's actually research to show that their perspective and understanding is important in preventing substance use. Right? So you can say, "Me mara dikra astej kari dios." Well, if they don't feel it, it's actually backfiring. They ultimately will seek refuge elsewhere through self-medication, through substance use, or by trying to gain acceptance by inappropriate peers. The National Institute on Drug Abuse has clear research outlining the methods to help prevent substance use and also mental, mood, emotional, and behavioral disorders, in fact, by different levels, national level, state level, local level, basing it on social, economic, and political means. I want to focus our attention on things that we have direct impacts on through parenting and interacting within our Dawoodi Bohra community. So parents and families can look out for these simple signs if they're using or abusing. And you guys are probably all familiar with this: changes in behavior, changes in sleep patterns, changes in changes. But if you are, as a practitioner, are evaluating them and you're using questionnaires like the Patient Health Questionnaire 2 or 9 for depression, there is some overlap, so keep that in mind. Don't just automatically diagnose them with depression. But you don't have to wait for signs to start talking to them and giving them clear, consistent messaging either, right? That's kind of on the later end. You want to give that to them in advance and keep it consistent throughout, not only middle school, but all the way throughout their adolescence as well. So what are some ways that parents can get involved? Just being around a child at home, doing your own thing, is not engaging with the child. Humna to actually ghanu thai use. Because of the pandemic, there's one parent at home, but are they really engaging with the child? Ye logo office ma betha che, bachao potanu kari riyas. Hamara household ma, that's kind of what's happening, right? My kid's on Minecraft. Now he's actually accessing servers and talking to people and advancing. What kind of people is he talking to? What kinds of things is he talking about, right? Do we really know what's going on? And he's only 12. Communication is super important, but it needs to be both ways. You can't just be the one talking, suno mari baat. You have to also listen. Ki ina man ma su thai rius, And where is he going, or she? Take into account their feelings, desires, and interests. Take an active interest in what they're interested in. How many of you actually have done that? Played the video games with your kids? Very good. Also, don't be in denial. We know addiction has a genetic component. Check your own family history. What is your predisposition for addiction? Be aware of that as well, right? Keeping children and teens engaged in community activities, sports, work. I see some people are bringing their kids in during the summer and having them work at work with them. Fantastic. Don't let them be at home texting and messaging all day. Maintain clear messages of the family rules. Hold them up consistently and explain the reasoning behind them as well. My way or the highway, that type of parenting style is not effective. Research supports this and may, in fact, again, lead to marginalizing the youth. So treat them with respect, come from a place of love and understanding, compassion. Another aspect that research has shown is that when parents start to take active interest in their own personal growth, meaning they take time out for themselves to take interest in hobbies, new hobbies outside of the home, they get a sense of fulfillment and happiness, and that spills over into their interaction with their children. So it's really important that you guys take out time for yourselves as well and grow. The bachcha will be enjoying. Okay, so these are the main 4 parenting styles. Authoritarian, that focuses on obedience, punishment, discipline. Right? Permissive, parents are warm, relaxed. They don't set limits to monitor children's activities closely, and they do not require mature behavior of their children. Uninvolved, parenting style, where parents are unresponsive, unavailable, and rejecting. Or authoritative, creating a positive relationship, enforcing rules, yet listening to the child's viewpoint, although they don't always have to accept it. Which of these 4 do you think would be the one that will be, it has evidence base to support the prevention of substance use? Let's guess. Almost. Authoritative, very good. Children raised with this style tend to be more friendly, energetic, cheerful, self-reliant, self-controlled, curious, cooperative, and achievement-oriented. By far the best suggestion. How many of us actually have this type of parenting style? I mean, take a moment and actually think about your parenting style. Do you really sit down and explain things to your kids? Or do you stand there and say, "Bas khatam"? Or you're just like, "Kahin nahi, bachchu che, sukar se." Really, you need to think about your own behaviors. And you don't want to be calling other people out on their behaviors. Pehla potanu tame karo, pachi bijanu thase. But really, I want you to take this into account. Authoritative. Of course, you have to be stable to be able to be authoritative as well. So we get some. So for that, and not everybody comes out of the womb stable, right? Some people have parents who were also like that. So really, what needs to happen is we need to train parents to be better parents. So the National Institute of Drug Abuse has even outlined how to train parents. There's multiple programs out there for different age ranges of kids, but for the parents primarily. And this one is the Triple P program. It's actually called the Triple P program, the Positive Parenting Program. And what they do is they teach you how to interact with your children, how to manage your emotions, your anger, your stress, and expectations. That is the biggest thing, expectations. We each have different expectations for our own spouses, right? So this one is the most effective for families in preventing substance use. It encourages parents to do these 3 things. Most of these you're pretty familiar with, right? Positive reinforcement, limiting criticism and punishment for instead a decrease in, consistent with a brief loss of privileges, timeout, and then increasing engagement, spending time with your kids, positive time. Not कि तमीना साथे बैठ होने पची गुस्सा में आवी जाओ गरी गरी ना ऊपर. That is not the same thing. This is also a very effective intervention for families who have kids with ADHD. So if someone can please help me convince my husband, we could both sign up for this, that would be great. This Triple P program, the Positive Parenting Program, shares a common theoretical basis with the social learning theory. It emphasizes the importance of observing, modeling, and imitating the behaviors, attitudes, and emotional reactions of others. So when parents learn positive parenting skills, it leads to fewer behavioral and emotional problems in children. So how can we, as physicians, help? Start by screening your patients, right? Only 50% of pediatricians actually screen their patients for substance use. And there's a myriad of reasons why. They don't feel comfortable, they don't know what to do, they don't know how to refer, they don't even know what tools to use sometimes. But amongst muminin patients, it might even be less, because we just assume कि नहीं करता होए. अपने गनीवार तो माँ बाप ने भी बाहर नहीं मोकला होता. Keep it consistent. Just like any other patient, muminin patients deserve the same confidentiality agreement as required by your state. So look to see what your laws are. And using tools like the CRAFT for alcohol assessment, HEADS for socioeconomic, psychosocial concerns, PHQ-2 or 9 for depression, assessing for mood disorders and alcohol abuse and dependence. There's another one called the SBIRT method. The screening to brief intervention and referral to treatment method. It uses the S2BI, a screening to brief intervention tool. It's a very simple tool. It has a few questions that ascertains for substance abuse, asking about smoking or tobacco use, alcohol, and marijuana use, with a little bit of a frequency question. And if any of those screen positive, it furthers it to other questions about other illicit drug use and non-prescription use. If any of those come back positive again, you do a brief intervention. So you talk to them. You use motivational interviewing questions. If you're not familiar with that, it's basically you have them come up with a solution. Similar questioning you would use for weight loss, for obesity as well. Because if it comes from within, they're more likely to do it. If they come up with a solution, they're more likely to do it than us telling them, Jo, tamne cut down from 10 cigarettes a day to 5 cigarettes. They have to come up with their own solution. And then you refer for treatment. But more importantly, that during all of this, you need to remain completely non-judgmental. Remain confidential, which is hard for parents, right? And then focus on the positive attributes. The fact that they're even telling you, acknowledge them for it. Thank them and praise them for that. At least they were honest and open about it. And then praise them for their willingness to potentially change their behavior and or for evaluation and treatment. So what do I want you to take home? Essentially is, although we probably want to say, ke jona mani galti cha, in this case, it might be a little bit, right? Parents have a huge and very important role in the child's development of social skills, maintaining emotional stability, improving confidence, and the prevention of substance use. So keep your children engaged in activities within the community, sports, academic programs, zakirin, volunteering. Keep them involved. Screen your patients, muminin youth or not, right? Maintain that confidentiality, judgment-free zone. And I would say we need to create an anonymous survey nationally, globally if we can. Muminin youth substance use. It's about time. And then if we can even go a step further, implement patient or parent training sessions, Jamaat-wide. So we can do something similar to the positive parenting training. And we can institute that monthly, bi-monthly, however it is. so we can encourage parents to learn how to be better parents. It was through this research that I actually realized that there's a change that needs to happen in my own household. So I hope you've learned a little bit about how you can help our Momineen youth stay drug-free, substance-free, and continue to do dua कि मौला ने दुआ ने नेमत सी हमारा बच्चाओं ने आप सी हमेशा अपना दामन सी वलगी ने रहे बद अमल सी दूर रहे अने मौला ने उमर शरीफ ने तारोज़े क़यामत दराज ने दराज थे. So let's keep in mind, preventing substance use in youth is one elephant in the room. Addressing medication use or abuse in adults for chronic pain and management is another elephant, which I think my colleague, Dr. Khuzema by Campwala, addressed karsa. Thank you.